Hey there. Today, I'm diving into something really important, Hunter syndrome. Ever heard of it? Well, it's a rare genetic disorder that mainly affects boys. Imagine your child's body struggling to break down certain sugar molecules. These sugars build up over time, causing damage to organs and tissues. That's what Hunter syndrome does. So what are the symptoms? Typically, they start showing up between ages 2 and 4. You might notice stiff joints, thicker facial features, delayed tooth appearance, and even hearing loss that worsens over time. Kids with Hunter syndrome often have larger heads, wider chests, and shorter necks. Growth can slow down around age 5, and you might see white growths on their skin. It's a lot to take in, I know. Now let's talk about the cause. Hunter syndrome is caused by a genetic mutation in the IDS gene. This gene regulates the production of an enzyme called iduronate 2-sulfatase, or I2S for short. Without enough of this enzyme, complex sugar molecules known as GAGs build up inside cells. This buildup damages organs and tissues, leading to the symptoms I mentioned earlier. Wondering how common it is? Hunter syndrome is pretty rare. It's diagnosed in about 1 out of every 100,000 to 170,000 male children. While females can carry the gene, it almost always occurs in boys. This is because the gene is linked to the X chromosome. Boys have only one X chromosome, so if they inherit the faulty gene, they'll develop the disease. Girls, on the other hand, have 2 X chromosomes, which gives them a backup. Now, on to complications. Hunter syndrome can lead to a range of problems like breathing issues, heart disease, joint and bone abnormalities, and declining brain function. It can also cause carpal tunnel syndrome, hernias, seizures, and behavioral issues. Managing these complications often requires medications and sometimes surgery. So, how is Hunter syndrome diagnosed? Healthcare providers use urine tests to check for high levels of sugar molecules and blood tests to measure enzyme activity. Genetic testing can confirm the diagnosis by identifying mutations in the IDS gene. Early diagnosis is crucial for managing the condition effectively. Treatment, you ask? Well, it's all about slowing the disease's progression, catching complications early, and improving quality of life. Enzyme replacement therapy is the go-to treatment. This involves replacing the missing enzyme with a human-made version called idursulfase, or Elaprase registered trademark. Kids usually receive this treatment intravenously once a week. There's also hope on the horizon with genetic therapy trials underway. Can Hunter syndrome be prevented? Unfortunately, no. Since it's genetic, prevention isn't possible. However, parents who have a child with Hunter syndrome might consider consulting a genetic counselor before having another baby. This specialist can help them understand the risks of passing the gene on. That's a wrap on Hunter syndrome. It's rare, it's complex, but understanding it is the first step in managing it. Thanks for tuning in, and don't forget to like, share, and subscribe for more insights. See you next time.